Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, India, would like to welcome you all in my Ayurveda Academy YouTube channel. My dear friends, my last video was regarding how the doctor is examining any adult patient in his or her general medical practice. Today, we are going to see the basic examination for any child. My dear friends, I have already the clinical examination videos on my channel. You can just check the playlist of clinical examination. There you will find examination of nervous system in detail, of course. Examination of respiratory system in detail. Examination of cardiovascular system in detail. Examination of pulse in detail. And all these videos are very, very popular. And there is a lot of demand from the medical students, Ayurvedic students, allopathic students, homeopathic students. Sir, please continue the series of clinical examination and clinical diagnosis. So here we are going to start the many videos regarding this clinical examination and clinical diagnosis. Today's topic is basic examination in any child. First, the doctor will see or keep his or her hand firmly over the forehead of the child, reassuring that the child should be comfortable. So the doctor has to put the hand firmly and reassuring over the forehead. Simultaneously, he will understand the temperature of the child. Move the hand up to palpate the anterior fontanelle. Anterior fontanelle, whether if it is open, because maturity should be there and all the bones should be calcified. Then, of course, he will understand whether the child is having any febrile condition, fever, pyrexia. And whenever there is a pyrexia or the fever, it can indicate that there must be some viral attack or bacterial attack, and let us check where is the septic focus. So doctor will proceed further. With the right hand of the doctor, he can see or retract the lower and then the upper eyelid. Lower eyelid and upper eyelid. First like this and then taking upwards. So the child's lower and upper eyelids, the doctor will try to retract, and the doctor will observe in the child whether there is any pallor. And pallor definitely indicates the child is suffering from low hemoglobin or anemia. And of course, the doctor will advise the blood test. The doctor will check the white portion for the icterus or the yellow color, which can indicate the child is having jaundice or infective hepatitis. Then on the sclera, if there is a scaling, triangular type of the scales are there, that can indicate Biot's spots. And these Biot spots in the eye on the sclera will tell you that the child is suffering from vitamin A deficiency. Doctor will also check whether there is any discharge from the eye. It can indicate some allergic or conjunctivitis problem. Next, the doctor will take the torch and try to inspect the tongue and the throat. Actually, infant, when the doctor wants to check the infant, throat can be seen, best seen when the child is crying. So actually the crying is not good, but during the crying, the doctor can easily check the throat condition. Next, the doctor will go for inspection of both the ears for any discharge, secretions or tenderness. Over the external ear, that means he can check pulling the pinna, and here also over the mastoid bone, both right and left ear. Ear examination in the child is very important because middle ear infection is very common in the children. When there is a discharge, it may be foul smelling. The child may cry. Child may be always putting his hand on the ear. That indicates the child is suffering from otitis media, infection of the middle ear, which is the common cause of fever. Next. Now, with the both hands, doctor palpate the neck for the lymph glands, especially in adult as well as in the children. Lymphadenopathy here on the neck or in the cervical region may indicate two important things or three important things. One, the nearby infection like ear infection can also give the enlargement of the lymph glands, or there may be some infection in the nipples, in the breast, that can also give the lymphadenopathy. And the most important, the lymph glands, if they are matted means stick together, 2, 4, 5 lymph glands are sticking together, that is called as a matting of lymph nodes or lymph glands. That indicates that tuberculosis infection. So whenever there is a lung infection and with tuberculosis, there is always a cervical lymphadenopathy. In the adult, of course, this is the examination of child, but I am telling you, in the adult ladies, if she has a breast cancer, the lymphadenopathy must be there. For that matter, doctor will always go for neck stiffness. That means he will try to flex the knee, flex the neck. Doctor will try to flex the neck. If the child is not allowing to do that, or his severe crying is there, then that condition indicates neck stiffness. My dear friends, neck stiffness is a very important sign which indicate meningitis problem, severe inflammation of the coverings of the brain. And meningitis, high fever will be there, neck stiffness will be there, Babin's skin sign on the feet will be positive, and these children should be admitted in the hospital immediately. So one of the important reasons for neck stiffness is meningitis. Next, the doctor will proceed for the chest inspection, palpation, percussion, auscultation. So the doctor will see the chest for respiratory movements. Respiratory movement, up and down, up and down. Also, he will try to undress the child's upper part, and he will see on the ribs rickety rosary or deformities. Rickety, which indicate the ricket disease, vitamin of deficiency of calcium, deficiency of vitamin D. So rickety rosary, you must check in the children, or the rickets deformity. Next, the doctor will try to palpate the apex beat, heart. Apex beat is related with the heart. Then with the stethoscope, doctor will check the heart sounds and the respiratory sounds. Of course, you know normal heart sound, lup, dup, lup, dup. But whenever there is abnormal heart sound, that is called murmur. Abnormal heart sound or murmur indicates problem in the valves, especially atrioventricular valve problem. Especially in the children, rheumatic fever is very common. Rheumatic fever in between 5 to 15 years of age. And the most dangerous complication of rheumatic fever is mitral stenosis or mitral regurgitation of the blood. This problem will give the abnormal heart sound, that is murmur. For example, lub, dub, normal. Lub, sh, dub, abnormal. Murmur is there. Or lub, dub, sh. So this sh word is indicating the abnormal heart sound, that is murmur. Next, of course, the respiratory sound. Normal sound is called as a vesicular sound. But abnormal sounds, because of the bronchospasm, rhonchi will be there. And whenever there is a fluid, for example, pneumonitis, RAS can be there. In the children, pneumonia is very common. If the child is crying, the doctor should auscultate the respiratory sounds during the inspiration, which always following a cry. Whenever the child is crying, after the cry you get the inspirating sound and you can easily examine that particular inspiratory lung sound. Next, basic examination in the child. Palpate the abdomen for the liver and spleen. Right side liver, left side spleen. You can check, the doctor can check for liver tenderness, which indicates also jaundice or hepatomegaly or even splenomegaly. Splenomegaly, the enlargement of the spleen, indicates malaria or hemolytic jaundice or hemolytic anemia. But here one must be very careful that in infant below the age of 1 year, try to understand, the liver is normally palpable. Liver is not palpable in the adult, not palpable after the 1 year, but below the 1 year of age, that is in infant, the liver can be palpable. Don't get shocked, that is physiological. Now, we are examining the child. The doctor will examine the limbs, hands and legs, especially for the wrist widening or any deformities, and he will also check the nails for, of course, the calcium deficiency in the adolescent age group, or there may be anemic condition, that is, in spite of convexness, there may be concave, there may be paleness. So all these things about the limbs, there may be edema. So all these things will be observed. And my dear friends, this is what I have discussed in last 7 minutes, 10 minutes. Minimum basic examination which should be done for each and every child or infant, irrespective of his or her complaints. My dear friends, if any of you wants the paid online consultation, you can definitely WhatsApp, because Ayurveda Academy has the team of the doctors. So you can WhatsApp on 92268 Yes, the number is in the description. My dear friends, I wish you all the best, and we will continue the series of examination of the patient for the different conditions as well, for the different health problems. So please like, share this video, and don't forget to subscribe my YouTube channel for getting such type of the interesting videos consecutively for the further few days. I wish all the best. Take care and see you in the next video. Thank you very much.